Hey Dental fam, it's your girl Leela. Who else? And welcome back to
the DA Study Spot, yeah.
This is part 2 of our series called DANB Basics They Don't Explain Well. Last time we talked about how to read the DANB questions properly, but today we're talking about something that gets people every time, the trick answers. Because you know what you're doing, they just like to distract you with those decoy answers. Let's go ahead and jump right in, but before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! Section 1, the first trap. The answer that is technically correct, but not the best answer. For example, a patient begins coughing during a procedure. What should the dental assistant do first? A, offer water. B, continue the procedure. C, stop the procedure and remove instruments. D, ask the dentist what to do. Pause this video and drop your answer in the comments on what you would do first. The answer for this question would be C, stop the procedure and remove the instruments. Let's break this down. So based on our last study session, we're gonna remove the most ridiculous answer, which is B, continue the procedure. Obviously, we're not going to continue the procedure if the patient is choking. The next answer to eliminate is A, offer water. While offering water is technically helpful, in dentistry, chances are in a procedure, there's gonna be water there already. We're not gonna offer more. Now, asking the dentist may sound respectful, but the DANB is testing priority and safety. And what did we learn from our last study session? First and immediately equals remove the source of distress. Here's a tip. If two answers sound right, choose the one that protects the patient immediately. Section 2 and the next trap, extreme wording. Watch for words like always, never, only, must, when it's not about safety. For example, which statement about PPE is correct? A, gloves are always required in every area of the dental office. B, gloves must be worn during patient care. C, masks are never optional. D, eye protection is only required during surgery. Did you pick B? As you should. Gloves must be worn during patient care. Why B? DANB avoids extremes unless it's about safety protocol. Words like always and never are usually traps. Anytime you see extreme words, pause, think, and eliminate the most ridiculous answer first. Section 3. This one gets people all the time. Scope of practice traps. The DANB loves to test what assistants can do, what only the dentist can do, and what varies by state. For example, which task may be performed by a dental assistant? A, diagnosing caries. B, prescribing antibiotics. C, placing sealant with proper training. D, extracting primary teeth. The answer for this one is simply C. If it involves diagnosis, prescribing, or irreversible procedures, that's dentist territory. Tip: if it sounds like a dentist decision, it probably is. Here's another favorite trick. Section 4, convenience versus infection control. Example, an assistant forgets to remove gloves before answering the phone. What is the correct action? A, wipe the phone after. B, remove gloves, perform hand hygiene, then answer. C, continue assisting and sanitize later. D, ignore it if no visible contamination. Pause this video and drop your answer in the comments for this one because this is a good one. If you said D, you good? DANB will always choose infection control over convenience. If one answer is easier but less sterile, it is completely wrong. Section 5 and the last trap to look for is when two answers look correct. When this happens, ask yourself, which one is safer? Which one comes first? Which one is within scope? And which one matches standard protocol? Always keep in mind, the DANB isn't asking what could work, they're asking what should be done. All right, y'all, that's it for this study session. If this video made you realize you've been second guessing and overthinking on those practice questions, drop a tooth in the comments. Next in the series, we're breaking down how to eliminate wrong answers fast. If you find this video helpful, give it a thumbs up because we're not just learning how to memorize, we are learning how to think like the exam. Subscribe to the DA Study Spot and share this video with a dental bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.